Hello, everyone. Thank you for joining us today. We are very excited to have you all to listen to this session. Ahmed, if you could please just mute your
Yes,
camera.
it's done,
Great.
done, done.
Thank you.
Done.
Okay. I wanted to start off by introducing, first of all, talking about the Humanitarian Relief and Recovery Task Force. I wanted to tell you that we started this task force in early of 2024, and this session is brought to you by the Humanitarian Relief and Recovery Task Force. This task force is hosted by the Arab Foundation's Forum Secretariat, and its purpose is to support the coordination and collaboration between Arab foundations and nonprofits operating in crisis and fragile contexts. So basically, we work to inform and coordinate Arab foundation and nonprofit interventions, as well as to advance localization and empowerment of local communities in these contexts by identifying their capacity and funding needs and supporting matchmaking efforts. So today, the task force has the honor of leveraging the extensive presence and experience of some of its members and their networks to inform you all and to provide ways to engage with the various humanitarian assistance initiatives that they have created. The task force is comprised mainly of AFF members, but is also open to participation by non-AFF members. I wanted to start by thanking all these expert panelists here with us today. They are literally the everyday heroes who work tirelessly to alleviate the suffering of their fellow Lebanese citizens and refugees alike. And I'm going to start by just introducing our panelists, after which I will introduce our esteemed moderator, Dr. Ali, and I'll turn the floor over to him. At the end, we can leave some time for questions and discussion, so please feel free to post any questions in the Q&A section down on your Zoom screen. It just makes it easier for us to kind of, keep track of the questions rather than in the chat box. But I will be posting all the relevant donation links from each organization, and in our follow-up email as well. I'll have all that information for you. So our guest panelists today include Samar El-Yasser from ANERA, Bilal Alimet from American Friends Service Committee. We have Mr. Ahmed Shafiq El-Haji from the Children's Cancer Center in Lebanon. We have Sausan Masri from Ta'awun and Bilal El-Namel from Leading Hands. And I think we have Sarah Hani, or we'll shortly have Sarah Hani, from Arc-en-Ciel. And finally, I'm very happy to introduce our moderator today, Dr. Eli Abououn. He presently assumes the role of Senior Policy Officer at the United Nations High Commission for Refugees Representation to Egypt and the League of Arab States. Dr. Eli is a visiting lecturer in various universities in the MENA region, and he serves as the Senior MENA Advisor at Strategy International in Cyprus. He has been a non-resident senior fellow at the Religion and Security Council in Rome since 2020, and from 2013 to 2023, he served as the MENA Regional Director at the United States Institute of Peace. Dr. Ali has held key leadership positions at organizations such as the International Rescue Committee, the Danish Refugee Council, and Arab Human Rights Fund, and other nonprofit entities. Dr. Ali is also a frequent contributor to various publications and continues to actively serve on the board of directors for several regional nonprofit organizations. He is also a doctor of dental surgery. Dr. Ali is also one of the original and central members of our Humanitarian Relief and Recovery Task Force. Dr. Ali, thank you so much for being with us today. And I hand the floor over to you.
Thank you very much, Nihal. Good morning, good afternoon, everyone. Thank you for joining this webinar on the humanitarian situation in Lebanon. On top of what Nihal kindly said about me, I would also add that I'm a member of the Arab Foundations Forum. I'm a proud member, actually, and I think the forum is doing a great job in the region, a job that not too many entities are actually doing. I'd like to thank the panelists as well. They were just introduced. I will not repeat the introduction, but I'm confident that all of the panelists come with a very deep knowledge of the humanitarian situation in Lebanon, and they will definitely offer very interesting insights about how things should be done and what needs to be done differently and or better. The situation in Lebanon is bad. I guess we all agree on this. At least it's been a while that Lebanon actually has been facing a complex crisis that has created a dire situation for thousands of families. The scale of this crisis, however, is monumental. Since 2019, Lebanon has been grappling with the aftershocks of the financial meltdown, followed by the COVID pandemic and then the port explosion. And now we're dealing with an armed conflict that has compounded the existing vulnerabilities to a large extent and is basically pushing the country into the brink of collapse. The most immediate challenges, are more or less known, I guess, the humanitarian. However, what I wanted to highlight in this opening remark is that the unprecedented and widespread displacement created by this conflict, also the scale of death, injury, destruction of infrastructure, etc., should push us to look beyond the immediate humanitarian needs, but also to consider what would be the long-term effects of what's happening today. And this is where I'm a bit, honestly, as on a personal level, I'm a bit worried because I don't see a lot of thinking going into the long-term effect. I understand that the agencies or organizations responding on the ground don't have the bandwidth now to think about the long-term effects, but I don't see at the level of the donors, at the level of the government, at different levels, I don't see any serious thinking about the long-term effect. Unlike in 2006, the return of the IDPs is likely to be very slow, if it will happen at all. And it's going to be very challenging because of the main political obstacle, which is Israel not accepting the return of IDPs to specific areas. Moreover, I think that we're going to face a situation where financial resources will be much less than in 2006. We will not have the largesse of the Iranian and the Qatari funding that were received in 2006 and that basically allowed the very quick return of IDPs to the region. So the displacement of so many families, or millions of people, basically hundreds of thousands of families, has already started exacerbating existing divisions within the Lebanese society, raising concerns about increased social tensions and potential violence on the longer run. The large presence of Syrian refugees in Lebanon adds another layer of complexity to the humanitarian situation, straining resources and potentially fueling also social tensions. We're all witnessing as well how the underlying political challenges are plaguing Lebanon for years now and are likely to persist, unfortunately, and which is hindering the economic recovery and reconstruction and will hinder the reconstruction efforts. So to discuss the current and the future challenges and to identify the most urgent actions that can mitigate the effects of the ongoing crisis, each of the panelists will have 8 minutes, as we agreed before, for a presentation. And then after, once the panelists are all done, we will have a moderated Q&A session for the remaining time of the session. I kindly urge all the panelists to stick to the 8-minute limit and the audience to be as concise as possible in their comments and questions so that we allow the broadest participation possible in this conversation. Thank you again. And without further ado, I'd like to start with Samar from ANERA. Samar, the floor is yours.
Thank you, Dr. Eli, for this. I'm Samar Yassir. I'm the country director of ANERA in Lebanon and Jordan. ANERA, for those who don't know it, it's a 501c organization established in 1968, working exclusively in the Levant area in Lebanon, Palestine, Jordan, and Syria to some extent. ANERA is mainly a development organization, but serves shifts into humanitarian assistance when emergency calls for it, and unfortunately in our region, it's quite often. So my presentation, or what I wanted to talk to you today, is the war on Lebanon and its effect, as Dr. Eli has mentioned, on the population, the civilians. We hear quite often in the media and that this is a war on Hezbollah. And for me, I want to take a moment to talk about, is it really a war on Hezbollah or is it a war on Lebanon? Because we ask ourselves, if it was only a war in Hezbollah, why are civilians being targeted? Why are hospitals being targeted? And why is infrastructure being targeted? We see three patterns on this conflict. First, conflict that is claiming lives and civilian lives, uprooting of communities from their from their villages and towns, and the destruction of homes and infrastructure. Every day since, and the war has started a year ago, not 2 months ago, more than a year ago. But that conflict has escalated 2 months ago to leave or to cause a humanitarian crisis. We're repeatedly seeing intensified airstrikes targeting displaced people, civilian infrastructure, claiming lives of, as I said, children, women, men, that we want to concentrate on. And most importantly, is also targeting humanitarian workers and health workers. To date, we have the conflict has recorded 103 attacks on healthcare and has left more than approximately 150 health workers killed and 130 persons injured. So it's very important to speak about this, to see the challenges that we as humanitarian workers having to work in this situation. And we have 1 million persons displaced around Lebanon. As Dr. Eli mentioned, we have a crisis in our hand and we needed to respond quickly. In an era that our first response was to provide dignified or basic assistance, basic needs to those civilians that had to leave their houses in a hurry and take refuge in collective shelters. So beddings, water, feeding became the necessity, because without which people cannot live. So these were our main assistance to them. And now, as well as medicines, medical supplies to ensure continuity of care. Then we started seeing patterns of increase in disease. We saw incidences of life scabies in different collective shelters. So we needed to prioritize, and still prioritizing, water and safety of water in the different collective shelters to ensure safety. Winter is coming. So with winter coming, lots of things needs to be prepared, especially in a country like Lebanon, where the climate is cold. Especially we have many collective shelters in high altitude towns. So blankets, winter clothing, but fuel as well is needed. So I know we don't have much time to really focus on all of this, but in addition to the basic assistance, the priorities that we see is winterization. We see a need to support, especially the displaced population, children in the education, so they are not left out, because the school year has started and many of the public schools are being used as shelters So many of the children, the vulnerable children in these displaced centers needs to be supported so they don't miss on the schools. And I will leave it to this, and I welcome questions in the end.
Thank you very much. I appreciate the timeliness of your presentation. Okay, I guess, Sarah. Okay, hi, Sarah. How are you? We
Hello.
missed you at the beginning of the session.
I was listening, but I wasn't
Oh,
visible. Yeah, but I heard
okay.
your introduction. Yeah, and
Great.
Nihal's, of
Okay,
course.
so Sarah, over to you then.
Sure, thanks.
8 minutes.
Sure. I was just crossing out some of the points that I've already written because they were already mentioned by you, Doctor, and by Summer. So anyways, thank you for this opportunity to let out these kind of sharings that we have. I'm Sarah Hani from Arc-en-Ciel, External Relations and Fundraising Department. For those who don't know, Arc-en-Ciel, it's a developmental NGO. So we mostly do sustainable interventions on the ground. We've been there for 40 years exactly, since 1984. It was established during the Civil War. And now 40 years later, we're back to point zero, doing the same kind of interventions, especially with people with disability. But we grew from being specifically working for those who were injured and wounded by the war to serving everyone in difficulty. So I think maybe most of you would know our work. We do work in, of course, for people with disability in the environment, waste management, hospital waste management as well. We collect and sort and treat 92% of Lebanon's healthcare system waste, the infectious ones. And we do work with the vulnerable youth, vulnerable women, refugees, nowadays displaced migrants and other vulnerable cohorts of the society. So despite our more developmental nature in our work, we are now doing, of course, emergency work as well, just like everyone who's been shifting or at least partially deviating their work to emergency to respond to the needs on the ground. So far, we've served around 112. We've provided 112,000 services to internally displaced people, mostly those in shelters, in the public shelters, but also those in hosted houses or in rented houses. And we've served around 5,100 IDPs with these 112K services. But just like Summer highlighted, the main challenges we've been facing so far, despite the big numbers that our reports show on daily basis, this is not happening easily, or it's not being smoothly achieved on the ground on daily basis. One, there are major overlapping in the interventions and services that donors find as eligible activities to cover. So we're talking hot meals provision, hygiene kits, and now we're pushing more for winter kits, which are more expensive, especially if we're talking about mazout, diesel, and briquette, wood kind of heating. So these are very expensive. So donors keep sending back and keep pushing back against these kinds of budget lines. So there are huge gaps in certain areas, especially in the midterm level, whereas there's overlapping on other aspects where we have redundance of resources, as ironic as it may sound that we have redundance in this time of crisis, but it's due to the overlapping and the limited vision, if I can say, of donors, especially when we talk about international agency and these bigger international donors. When it comes to smaller foundations, to individual donors, things are more negotiable and more flexible and are more needs-based from the ground, as opposed to coming from above, as in what we agree on funding and what we accept as funds. So there's a challenge there, that especially as a fundraiser, to push for donors to really provide the kind of services the beneficiaries need on the ground, not just as short term, but as midterm, which is the more challenging aspect here. Again, I don't want to repeat what Summer mentioned, but everything she's mentioned concerning the the return to the houses, to, if anything, as you mentioned, Dr. Edie, if they would be going back. The education is a major challenge we're facing now. We have specialized classes for children with disability in Tanayir, in the Bekaa, but there are so many challenges in whether we get the children back to school, and it's an inclusive school. So we also have children without disability, if we get them back to school or not. The gap that is being created between those who are getting an education now, who are being enrolled in school now, versus those who are still staying at home, whether because their schools are being turned into public shelters or because they themselves are staying in red zones and risky areas that they cannot commute to schools. So there's a huge gap growing in education. There's reluctance or unclarity among donors as in what to do next as midterms. So whenever there are proposals that we write calling for midterm plans and for midterm visions of activities to start preparing for, to start assessing on the ground, this doesn't seem as a priority in their agenda, due to the political nature of the conflict, of course, and it's not just strictly limited to Lebanon. Understood, we're talking about a broader issue. It's regional, it's international. So there are so many factors that are playing part in this equation that's making it harder for donors to even look midterm plan, let alone longer term, as in returning back to their original home. So this is another challenge that we push for, especially coming from a developmental organization, that we want to look at the midterm level, what to do next. How can you start preparing for that? What are the possible potentials we have and opportunities we have to start preparing for? But we are finding some, like I said, some resistance from donors on that. And the third point I just wanted to highlight out there are so many efforts being put by the government, by the Ministry of Environment, by the hospitals themselves around the waste management, but it's not enough. And this is a huge fear we have, which we saw during the COVID-19 pandemic, where we reached out to UNICEF asking for more severe intervention to help mitigate or to help avoid possible infections and possible crises following the actual pandemic. And they were very helpful and very cooperative in that. So that's a third point I wanted to put out there. We wanted to put out there as Arc-en-Ciel, the plans for waste management, whether we're talking municipal waste coming out from all the shelters, especially
Sarah,
with
1 minute left, please.
Sure, especially with the density in these areas we're living in, and among the hospital care waste and all the infectious healthcare waste coming from all the increased demands on the hospitals and the medical centers across these regions of Beirut and Mount Lebanon. So these were the main points I wanted to highlight. We wanted to highlight, and I was representing Arc-en-Ciel through. Thank you.
Thank you, Sarah. Thank you very much. Moving on now to Bilal. Bilal.
Thank you, Dr. Ali. So I'll start with a brief introduction on the American Friend Service Committee. So the American Friend Service Committee, sorry, it seems that I can't control the slides. Okay, so the American Friend Service Committee is a Quaker organization founded back in 1917, mainly focused on peace, social justice, and providing also humanitarian aid. We combine practical assistance, advocacy, and also education to address social and political challenges. We've been operating in the Middle East since 1947. The organization has offices actually in Jordan and also in Palestine. We operate through local partner and civil society organization in Lebanon, and we have managed through our work in the region to build strong connection, though we didn't have any operational offices on the ground. Basically, for several years, we've been implementing cross-regional initiatives in Lebanon, trying to work with refugee and trying to focus on youth, and also trying to link with the Syrian and Palestinian refugees in Lebanon, and trying to build more in connecting the Palestinian refugee regionally, trying to counter the fragmentation of the Palestinian identity. And I think this leveraged us with a very strong connection on the ground to the different community and also to the different partner. The organization general focus on peace and conflict transformation. Also, at the same time, we're focused on economic justice, supporting fair wages, worker rights, and also equitable economic policies. Humanitarian aid was also one of the main area of focus for the organization, and we usually respond to the different humanitarian situation in the region. We've also responded to the Beirut blast through the different local civil society organization and also local partner that we've been working with. Also, at the same time, we always invited the youth groups that we were working with to be part of the active work on the ground, and because we believe the youth community is always a key to enter the different communities that we're trying to target and work with. And we believe in their role in leadership and advocating for their right on the ground, and also their leading role in terms of connecting to the different communities. Nowadays, since the escalation started in Lebanon, we've tried to focus on Beirut, Mountain Lebanon, Iqlim al-Kharroub, and Saida. These are the main area of focus that we have for the time being. And also at the same time, we have a focus on the Palestinian refugee camps in northern Lebanon and Beirut, because we believe that the different refugees in Lebanon are going through an intersectional challenge when it's come to their situation on the ground. And we believe that we need to kind of prioritize these communities that are going through too much, not to leave behind anyone. So we have a holistic and a comprehensive approach toward the community that we're trying to support. So we keep communicating and working with our local partner on the ground to make sure that we're addressing the most urgent need and also the most vulnerable community when it comes to providing them humanitarian aid, and also at the same time trying to build on our youth network that is operating on the ground through the different volunteers and also through the different youth activists. We focus on, as I said, on Palestinian refugees and Syrian refugees, but also at the same time, we know that this is a very complicated situation on the ground. So we're trying to, let's say, have a more comprehensive approach when it's come to the population that we are aiming to serve. The main relief efforts that we're trying to lead with our local partner are focused on distributing of hot meals, hygiene kits, blankets, mattresses, medical supplies whenever possible. And also we're trying to support the hosting families in the camps. We know through our different partners that there are like so many families who moved and now they're hosted within other families in the different camps. So it's overwhelming for everyone. So we're trying to have more focus on these families. And also at the same time, we believe that there is it's not a, I would say it's not a privilege, but I think there is need to be some psychosocial support and the social emotional learning session that we're trying to provide for the youth and the children, because we know that this is a very hard and unique situation for the different communities that we're working with. I don't want to be repetitive, but I think through the different discussion and through the different conversation that we keep having with our local partner and our youth network, we believe there is three main challenges that we face, and they're resource constraints. And I think some of my colleagues already highlighted this. And I think it is a complicated, I would say, discussion when it's come to how to engage the different donors and different supporters to have more focus on supporting the vulnerable communities that are affected It is very political, but again, at the same time, it is a humanitarian situation. So I think politics need to be put aside when it's come to the intervention. However, also we think that there is also a limited support that is going for the refugees and also for other vulnerable communities, because in a way or another, they're kind of excluded from the emergency response plans that have been set by different entity. And I think also even at the national level, they were not kind of highlighted or engaged in the conversation. And again, also there is this operational challenge, how to make sure that we're leading our distribution in a safe manner and also in a dignified way, considering the security situation and also considering the overwhelming challenges that were there even way before the whole escalation start. We have a belief in the community-based support and collaboration. So even if we don't exist on the ground, we don't have
Bilal,
offices.
1 minute left, please.
Yes. This is the last slide. Even if we don't have offices on the ground, but like again, we believe that we need to work through local partners. So we work closely with community leaders, UNRWA, and also other local organizations. And we believe that there is need to be psychosocial support that engage the different community members, especially youth, trying to promote further social cohesion activities. And also we're trying to focus more on the most vulnerable communities. Thank you all.
Thank you, Bilal. Moving on now to Imad.
Yeah, hello. I'm Imad Al-Haji, the Public Relations and External Affairs Team Leader at the Children's Cancer Center of Lebanon. I just want to go back a bit to your words, Dr. Ali, thinking beyond the crisis and the long-term effect on the community that this crisis causes in Lebanon and the NGOs. Allow me first to brief the audience about the CCCL. CCCL founded in 2002 in Lebanon, and the mission is to provide standard cancer treatment to children in Lebanon and psychosocial support. And embedded in our missions is to raise awareness about the disease in order to keep the cure rate of the Children's Cancer Center to 80%, and in some types of cancer, 93%. We provide this free of charge and regardless of any background. And we do that through fundraising. This fundraising includes programs with private sector and individual donations and grants. So far, the Children's Cancer Center had treated over 5,000 kids with cancer. And on a yearly basis, we cater for 50% of incidents in Lebanon, around 400 cases. Our annual budget is $15 million. And like I said, this depends only on fundraising and donations. Now we are registered in, like my colleague said, we're registered in the US, so we're 501. We're registered in the UK, we're registered in France and in Dubai. This gives the privilege for our donors to actually receive a tax relief on their donations. The Children's Cancer Center current situation, as all NGOs, due to the postponement of fundraising activities and due to the shift of priorities for donors, the Children's Cancer Center is facing currently around $3 million deficit. This is causing the CCCL, or may cause, or could cause the CCCL in 2025 to start saying no to children. This has never happened in the past 22 years. We've always said yes to our children, and this could rise up to 20% of cases we take on an annual basis. This is that's why we're here. We're here to ask donors to actually rethink their strategy as the shifting in priorities in previous years, during COVID, during the revolution, during the explosion, had demonstrated to us as a Children's Cancer Center that delaying in treatment of these children can decrease the cure rate and add the burden on the Children's Cancer Center. That's mainly the reason why we're here, but also to ask if any more information is needed, they can follow or check our website. I'm sure Nihal will share the link, and I'm ready for any questions.
Thank you, Ahmad. I appreciate you gave us back 3 minutes and a half. That's not bad. Moving
If you
on
want,
to
I can
Sausan.
continue.
Sausan, please go ahead.
Hello, everyone. So I'm Sausan Masri, the director of Ta'awun Lebanon. I will divide my talk to 3 pillars or to 3 sections. I will brief about Ta'awun, discuss a little bit the issue of Palestinian refugees and the needs during this emergency, and then discuss a little bit about what we're doing and what the needs are for the emergency situation in specific. So Ta'awun was established in 1983 in days similar to those days after the Israeli invasion to Lebanon, with a budget of $4 million when it was established. And it grew now to have an office. It's a Swiss registered organization, established in Switzerland and Geneva. And we have operations only in Palestine and Lebanon. The mandate is to serve Palestinians mainly, with a sister organization in the UK and a representative office in Jordan. In brief, what we do, I always present Ta'awun saying that we fill the gap of UNRWA. So basically what we do is serving Palestinians in Lebanon and trying to do what UNRWA is not providing. So we provide an early childhood education and certain health services, whatever UNRWA is unable to provide or is not providing adequately. We touch the lives of around 100,000 people every year with a budget of $5 million. The current situation and situation of Palestinian refugees, I will reiterate what Bilal has noted. Definitely, Palestinian refugees are already an impoverished community, and the multiple crises that Lebanon has been facing have further deteriorated their conditions, with poverty rates estimated to reach between 80 and 90%. So we're talking about a population that lives in an extremely dire condition. They're excluded from most of the government services, and they rely heavily on UNRWA services and on the services of civil society organizations. And this also puts another pressure on UNRWA. Their situation puts another pressure on UNRWA, who is already under financial crisis and severely underfunded. So this is just to give the situation before the escalation of the hostilities and the attacks on Lebanon. On top of that, there is limited funding that is coming to the Palestinians in Lebanon, because after the Syrian crisis, Syrians have been given priority, and the hosting community that is hosting the Syrian refugees has been provided some funding and some support, whereas Palestinian refugees remain excluded and benefited from the fringes of the benefits of the Syrians and Lebanese. So this is just to give a little bit of how Palestinians are living. This emergency situation has even deteriorated their conditions and the living conditions they have been facing, and many of the hot zones or the areas that are under attacks, many Palestinian refugees are located within those areas. So we have witnessed the influx of refugees, of Palestinian refugees from the south, from the camps in Beirut and Tyre. UNRWA has designated collective shelters, 11 collective shelters in the north and in Saida, to host those Palestinians who have been, and to host also Palestinians, Lebanese, and Syrians. So this is just to give a background. As Dr. Eli noted, the situation is a bit troublesome. We have witnessed the 2006 war. I was already working with the UNDP at that time, but it's not the case now. It's definitely not the same. As a little bit Dr. Eli noted or mentioned it, this time we have much, much less funding and much less donor attention. The government is not capable as it was in 2006. The government is already in a state of failure and in a state of limited, if not to mention inexistent capacity. Ministries are underfunded, under-resourced, both human and financial resources are lacking. Political parties in 2006 were also engaged and were able to provide support, which is not the case now. So it's not similar to what we had in 2006, definitely. And the scale of refugee and the scale of a population who is in need is definitely much larger, because besides the Lebanese who are being displaced, we have 1 million Syrian refugees who were not there during 2006. So this is also to add on the burden. What have we been doing over the past month or so? We have been delivering the normal emergency support, as many of you mentioned, hot meals, ready-to-eat food parcels. For Ta'awun, we provided assistive devices to those who are disabled. We maintained kidney dialysis services to those who were displaced kidney failure patients. We provided food parcels and non-food parcels to those who are in rented homes or hosting families. Again, this time we tried to fill the gap of UNRWA. So UNRWA, for the first 1 month of the emergency, was not able to provide food to the people in the collective shelters. We were the main providers of food in 6 collective shelters of hot meals every day. So this is to give an idea of what kind of interventions. But before I finish, I want to just highlight the challenges and the needs and the if I should say, the points that we really need to keep in mind whenever we're discussing the situation and we want to act upon that situation. One is that we really need to leave no one behind. Palestinian refugees, Syrian refugees, maybe certain population groups, the disabled, the elderly, female-headed households, people who are in with hosting families or in rented homes, they're often also neglected. And in this crisis also, I want to note that only 25% are in collective shelters, because I think people are afraid to stay in collective shelters based on the experience of Gaza. So many are actually in rented homes and they're difficult to reach. This is another issue, is to really make sure to reach those who are in rented homes, because they're often in need. There are many people who are still in inaccessible areas. Baalbek, for instance, I know that in the Palestinian camp in Baalbek, there are families, Lebanese families that are seeking refuge in the camp, in the Jalil camp. So, and it's a place that nobody is able to reach. And we've been trying to see how to actually support people who are seeking refuge in Baalbek. And to date, we're unable to find a way for that. So this is also another thing to consider. NGOs are already under pressure. NGOs, even before this crisis, have been playing a role that usually governments should play. I give an example from Ta'awun. We provide kidney dialysis services to Palestinian refugees for free. This is something that an NGO should not do, and we've been doing that since 1996. This is something that governments usually do. We train teachers in KGs, and we provide a monitoring tool and standards for teachers in KGs. This is something that governments should do. So already NGOs are under severe pressure before the crisis. Over the past 5 years, as Ta'awun, we have launched 4 emergency appeals in 5 years. I don't think this is something that's normal for NGOs to do continuously. And every crisis comes and destroys the progress that we have done, at least in the past few years. So it's really a very difficult situation. People are in urgent need. They're very much, and the scale of the need is huge. I think this is something that we have not witnessed before. I used to work on poverty 20 years ago. Poverty rates were 30%. And when we launched the first poverty report in Lebanon, I remember the political scene was very angry to see the rate of 30%. And I think if now we have a new household survey to measure the poverty rate, it would be enormous. So this is something to give the scale, the urgency of the situation, and to support NGOs who are already on the ground, because the burden that they have been holding has been really immense. And this is another thing that to add on their shoulder, with a very big question: how long will this war last? If it will last 1 month, that's fine. Maybe we can manage. But what if it would last another year, similar to what Gaza is facing? This would really be, I don't have an answer to that, but this would be, I think, the big question. And this is what we really need to consider and think of and act upon. Did I go beyond my 8 minutes? You're muted. Eli, you're muted.
Sorry. Yes. Yeah, I was saying that you went a little bit over time, but that's fine because Ahmad gave us back some few minutes. So anyway, last but not least, we have another Bilal from Leading Hands. Bilal Namel, the floor is yours.
Hello everyone, I'm Bilal Namal, Executive Director of Leading Hands Organization and Lebanon Tripoli. It will be with me now Mariam, my colleague. She will explain the presentation in English now.
Hello everyone, I'm Mariam. I'm working with Leading Hands as a project officer, and just let me share the screen about the presentation about Leading Hands. Okay, can you see the share screen? Can you see the share screen? Is it clear now?
Yes, yes.
Okay, thank you. So Leading Hands organization was founded in 2019 by a group of ambitious Lebanese youth to support marginalized communities in Lebanon, officially registered in 2020, number 1153.
Sorry, Mark, can I ask you to put the actual presentation? We're seeing your folder with 2 documents, but we don't see the slides per se. So can you put the slides? Can you make sure the slides are on the screen?
Is it clear now?
Not at my end. I don't know if others are able to see the actual slide or just the folder.
Are you able to see it?
We are seeing the folder.
Just folder? Okay, and now?
Yes.
Yeah.
Now we can see the slide.
Yeah, sorry. So I was introducing about Leading Hands. It was founded in 2019 by a group of ambitious Lebanese youth to support the communities in Lebanon. And it's officially registered in 2020 under number 1153. It's located in Tripoli. The office is in Tripoli. And already the executive director, he introduced himself. Here's about the vision and mission for Leading Hands. We strive to cultivate resilient communities. We are working for the sustainability and social cohesion. In this ideal future, we aim to eliminate poverty, improve education and healthcare outcomes, and promote gender equality. And we are working for the youth development, for livelihoods. We're offering education and vocational training, and the community engagement for the initiatives. And now we are working for the emergency response for displaced people in Lebanon. We start from since the crisis start. We try as much as we can to help the people, the displaced people in Tripoli. We start for distribution of essential supplies, including clothes, blankets, sanitary pads, hand gel, shampoo, conditioner, toothpaste, brush teeth, hand soap, tissues, pillows, and bread. Around 3,256 items till now. We promoting the public health, improving mental and physical health, and promote health sensitivity. Actually, let me start about the needs. We really urgent needs for displaced people in Lebanon, especially in Tripoli. About the basic essentials, displaced peoples need hygiene kits, food, blankets, and warm clothing as they live in shelters. We had 27 shelters, mostly in schools in Tripoli area. We need health services. They need quick access to medical care, mental health support, and health facilities to manage increasing health issues due to displacement. And actually, we are working about the awareness and education, the projects to raise awareness about gender-based violence, the GBV, and to educate on how to prevent, report, and respond to such violence, because around 52% of the displaced population are women in Lebanon. The challenges in meeting these needs, it's about lack of resources. As I mentioned, we really miss the funding to provide the supplies like food, water, and healthcare. The public awareness and community engagement. There's low public awareness and support limit the response to this crisis about the fake informations, and not everybody knows the real the situation about Lebanon. And people can support the displaced in several ways. About the donate supplies, about donating hygiene kits, clothing, blankets, and food directly helps displaced families. And we need financial donations, and this also help to buy necessary supplies. Actually, and raise awareness. Sharing information about the crisis on social media and community events or in discussions can help spread the word and inspire more support for us. Join fundraising events, organizing or participating in fundraising events for NGOs. Working on the ground helps ensure this organization get the resources they need to respond effectively to this crisis. Okay, I wanna share a human story. It's can you see it? Okay, so it's on November 11. It's before 2 days. There's a town in Ain Yaqub in Akkar. Was hit by an unexpected Israeli airstrike. The attack killed at least 30 people and injured 15 others, with some still missing. The strike destroyed a 2-story house where displaced families were staying, causing heavy damage across the area. Bodies and debris covered the streets, showing the scale of the tragedy. Firefighters and Red Cross teams from different areas arrived quickly to help. And this is an emotional story about the son and his mother. During the rescue efforts, a powerful moment happened when a son discovered that his mother was still alive under the rubble after hours of searching. He had been waiting and was afraid until a rescuer told him they heard a faint sound beneath the debris. The son ran the spot and found his mother weak and frightened, but alive, pressed against a broken wall. Rescue teams carefully cleared the rubble to get her out safely and took her to the hospital. Their reunion was filled with strong emotions, capturing both the pain and hope felt in the midst of the destruction. And this is the picture about the son and his family. And the donation, it really can help us to complete our mission and to try as much as we can to help the displaced people in Tripoli and in Lebanon. Thank you so much.
Thank you very much. Thank you.
Thank
That
you.
was
Thank you, everyone.
8 minutes sharp. Thank you very much. So we'd start. We start, as I said, the discussion As I can see in the chat box, there are no questions. I do have a few questions, if you don't mind. So I'd like to ask, and this is a question to all the panelists, so feel free to weigh in. Did you notice any changes in the way donors are looking at the crisis in Lebanon? Like in the last, because we've seen an unprecedented escalation since mid-September, right? And most of the displacement actually happened after this date. So have you seen any change in the patterns at the level of the donors after mid-September? And if yes, what are these changes, and what else should happen?
I can answer Eli first if you don't mind.
Go ahead.
Sure. Like I said, the shifting of priorities that had happened had changed the way of thinking for donors, and we've noticed that the donors are tired. They're tired from keep on giving and seeing their donation destroyed, or their donations are put in the wrong place. These are the cause of shortages of donations. We've noticed that in Lebanon, as a CCCL, our donation used to be 80% from the locals and 20% from abroad. These days, and since 2019, the percentage has changed. We've seen a shift, and I understand why. It's a crisis after crisis. It's the devaluation of the currency. It's the insecurity. It's the instability of social aspect of living. So all these have forced the locals of thinking again, and maybe perhaps saving for bad days. But
Thank you, Amo.
doesn't mean that they shouldn't. I'm just saying the pattern that. But any like we say in Arabic. شو فلس الأرملي بيسند جبل أو حجرة بتسند جبل. فلس الأرملي
I think we got it. Thank you, Ahmad. Thank you. Samar?
Yes, thank you, Ali, for this question. From what we're seeing, that definitely there's some donor fatigue, but every time we explain, I think it's very important to advocate for Lebanon and the needs, especially among donors in Europe and the US, where I don't think they understand fully what's happening. So when we reach out and we explain what's happening, we're saying more sympathy and we can mobilize more resources for Lebanon. I've seen the need for education, raising awareness about what's happening. As I said in my presentation, it's very important to emphasize the humanitarian crisis, the needs of civilians, because it's portrayed in media as a war on Hezbollah, while in fact it's a war on Lebanon and it's the civilians of Lebanon. Thank you.
Thank you, Samar. Sausan?
I would say there is definitely a change in the funding pattern. One, in the terms of volume, definitely it's not the same volume that we had before. Even when you look now at the Paris conference, and if you compare it to previous Paris conferences, Paris 2 and Paris 3, and before that, definitely there is a much less interest in funding Lebanon. This is one. And definitely when it comes to individual donations, I'm talking about multilateral and bilateral donations. And to individual donations, similar to the case of Children's Cancer Center, or maybe individual donors supporting several organizations, definitely the capacity after the crisis has become much, much less. And there's a political agenda for funding. Funding has always serves political agendas. When the Syrian crisis when the Syrian refugees came to Lebanon, there was plenty of funding coming to support the Syrian refugees, a very just and fair need, and the need was very much valid at that time. But there is equal need now. So I don't see interest in funding among donors. And if you look at most of us where we're intervening, not much support is coming to most of the collective shelters and to the families in need.
And is it true? Like I heard the rumor, I don't know if it's true, but because you're on the ground, you may be able to answer. Is it true that some of the donors are just diverting resources from the Syrian refugee programs to Lebanese IDP programs? Like they're not adding money; they're just telling you instead of using your budget for this, use it for that. Is that true?
Reallocations, yes, we have. But I think I would give that some of good attention, good intention. That if you need to reallocate for the emergency, you can do that.
There's two, the trend is both, I think, to be fair. So there is flexibility to use existing budgets to reallocate them to emergency from different donors. And now with the escalations that happening and the realization that it's a longer war. So we're seeing new funding coming. It's not up to the pledges or the needs. I think in the last publications from the United Nations, only 23% of the appeal has been funded, but there is some new funding coming. It's definitely not yet up to the level needed.
Thank you, Sarah.
Yes, I wanted to say that the most updated document from OCHA said that 35% of the $426 million needed have been received. So I think it grew a little bit to 35 from 23 in the report before that. But yes, as Arc-en-Ciel, I can tell that over the past 50 days, there has been a turning point, as mentioned by Samar, that donors realized that it's a longer term war. They started understanding the scene better on the ground. And this is when we started receiving more new funds or new calls for funds. That's just like less than 3 weeks ago. But up until 2 to 3 weeks ago, it was mostly the reallocation of existing funds from the current beneficiaries, be them Lebanese and Syrians to a lesser extent, to the IDPs. But there has already been a shift within this 50-day time span. Yeah.
Thank you, Sarah. Well, usually appeals that are answered up to 35%, I mean, it's not bad compared to other appeals in the region. So that's some sort of good news. Okay, my second question is about the transparency of aid. We all know that in Lebanon, there's a public perception about NGOs that it's all about corruption and nepotism. And this public perception can be right in some cases, but in many, many other cases, it's not really reflective of the reality. So my question to each one of the panelists is, what are you doing to communicate on your own transparency measures? Like, how are you dealing with this public perception? What are you doing to deal with it, basically? And what do you think, what other actions do you think should be done to address this issue? Thank you. So we'll start
with me.
Eli, we didn't تفضلي Sausan.
I think there are certain people who are already active in the civil society sector. They know what is it that makes an organization credible and trustworthy and accountable. But I think there is maybe a general awareness that is lacking about what makes those organizations accountable. And usually there are many. There should be an elected board, and most of us, all of us, I think the ones I know at least, have those. We're audited by external auditors and credible external and internal auditors. We have our accounts noted publicly. So there are several tools to really ensure that this funds that have been received are accountable and the organization is trustworthy. And any fund and the donors, the types of donors that each of us is getting funding from is also a source of, I tell you, multilateral donors and bilateral donors have very diligent measures to ensure accountability. Now, as I speak now, we have 3 auditors from 3 different parties auditing our financial records, from UNICEF, from OCHA, and our own internal auditor. So I think the tools are many, but the problem is how to ensure and how to increase awareness about what makes an organization credible or not credible. But I very much resonate to what you say. Sometimes myself, I dread saying that I work for an NGO because of this misconception. But I think there should be a general awareness about that, and I totally agree. Even sometimes I receive individual funding as an organization, we receive individual donations, and we always stress that you need to have the receipt. But people would say, no, it's okay. So this is what kind of, I think,
But Sausan, if I may interject here, and before moving to Samar, because she raised her hand, I'd like to draw a difference between compliance and accountability. What you mentioned is basically compliance, right? Audit reports, financial reports, invoices, receipts, whatever, procurement. But I think the problem in Lebanon, or the mistrust in Lebanon, does not stem from the lack of compliance. It mostly stems from the lack of accountability, including accountability to the affected population. And this is one of the major weaknesses that we've been suffering from in Lebanon. We don't have this culture. We don't think that we're accountable to the affected population. We think we're only accountable to the donor. And we like to host the auditors and to treat them well, but we don't communicate with the affected population. So my question was more about this type of accountability, not the compliance. But thank you I appreciate your answer. Samar, would you like to weigh in on this?
Yeah, thank you, Eli. I think this topic is really, really important, and it merits a whole webinar on its own, because I agree with you. Accountability to affected communities is really important. So at ANERA, we do a number of measures. One of them is publishing on all our social media and our websites a daily log of what we're doing and where we're doing this. All our interventions are publicized. In addition, in all centers that we publish not only what we're doing, the source of what we're doing, but also getting feedback from the people we serve. So there's a hotline, that people can get back to us and ask questions on the report, and we take seriously every remark or every feedback we get. So these are parts of what we're doing at ANERA, and I think more can be done, but at this point this is what we're doing.
Thank you, Samar. Bilal, Olimat, over to you.
I just want to add 2 more things that we do at the center.
Sorry, Ahmad, I want, because Bilal raised his hand before you, and then I move on to you. Bilal, تفضل.
Sorry, and actually, in response to your question, Neri, I think it's very important what you mentioned about trying to draw this line between compliance and accountability. And I think we can't ignore the political factor around the funding and around also the donor relation with the different international or local organization. AFSC had, I would say, like both experience. We've been receiving funds, and also at the same time, we've been also acting as donors for some local and also international partners. And I think what's happening actually in this field is that there are like so many organizations who became kind of expert in how to be compliant with the donor requirement, but not necessarily that mean that they are responding to the community needs. And I think one of the good practices that we've learned so much from is to work through networks and volunteers and activists. And I think that's where you connect directly to the field. I think it's a bit fluffy in terms of the structure and compliance and audit and all of that. But like again, I think it gives you a hands-on experience on the ground in terms of the needs and also in terms of the response. And I think it's also very important for the organization to do more advocacy and to do more, I would say, collaboration in terms of how they manage their relation with the different donors. We know that there are so many organizations that are donor driven. So once the donors say, okay, this is the interest, this is the area that we want to focus on. And I think all this pressure toward redirecting the funds from the project that were meant to be for Syrian refugees toward Palestinian refugees is kind of also like giving a very clear example of how the funds are also being used to manipulate, I would say, the dynamic of the different communities and also the different groups in the ground. So I think there need to be more dialogue among the different organizations and rethinking their relation and the way they interact with the different donors. Because at the end of the day is that, like so many organizations are only following the donor or the trends, I would say. And I have seen so many organizations trying to step in to work in Lebanon just because of the crisis. And also this have been also done so many times.
Thank you.
With Jordan or Palestine or other places.
Thank you, Bilal. Imad, تفضل.
I just wanted to add that as a CCCL, we're an ISO certified organization. And it's not only audited on finance, we're audited on the CCCL finances, but we also audited on the processes and procedures that we apply at the center in order to have a well-governed operation. In addition to that, and to add on Bilal, recognizing donors, which we have at the CCL, different schemes for different type of donors that their names are stuck on walls of the center, can also add accountability to our beneficiaries when they come into their centers and see the numbers and the name of donors. And in addition, that we are a United Nations Global Compact Network member, and we report every 2 years on exact numbers of served populations, and that's nothing to do with the finance. This is accountability on serving the population that we are currently trying to cater for. So in these three aspects, this can add accountability on organizations.
Thank you. Sarah, if you don't mind, I'd like to put you under the spotlight. Yes, I have to make a disclosure here. 20 years ago, I used to be the director of the department where Sarah is working right now.
Seriously?
Oh, wow. I was the first director of this external relation department. But anyway, and I know that Arc-en-Ciel is one of the very first Lebanese NGOs who established a very special relationship with their affected communities. And back then, 30 or 40 years ago, this whole concept of accountability to affected communities was not as developed as it is today. But some people in Arc-en-Ciel back then had this reflex of establishing a kind of a two-way communication, trying to better understand the needs, the concerns. So can you tell us a little bit where Arc-en-Ciel is standing on this specific aspect right now? And sorry again for putting you under the spotlight,
No,
but
it's okay.
I can't.
You know Hiyam Fakhouri then, I believe. We always say whenever donors, this is what we're always told, especially when we first come to join Arc-en-Ciel, that yes, we follow donors' guidelines and requirements, but we are the ones on the ground. We are the ones who know what the field needs, and we're the ones in direct contact with the beneficiaries, and we have the sense of responsibility towards our beneficiaries. So we always negotiate with donors whenever it's possible, of course. Some donors is just a one-way communication. But yeah, this is why we always work in areas that we only work in. So we don't go and expand our operations in regions or that we don't initially have any presence in, for that very simple reason, to remain accountable to our beneficiaries. So we have 12 centers We work within the catchment areas around each of these centers, so we can build this this sense of relationship with the beneficiaries, that they know that they can walk in, that they can express their needs, that there is a two-way communication with them, that we know their needs on the ground, we know the entire households. We're not just talking about one beneficiary per one service. This is why you would see that we have 112,000 services to 5,000 beneficiaries, because we provide collective services to one beneficiary to make sure they're really being impacted and really having their lives changed. So this is our accountability towards beneficiaries, that we're there to stay. And we always tell donors this: we don't do hit and run acts unless it's times of emergency like now, because we're there to stay. We have sense of accountability towards them. We need to make sure that they are assured that they're not just numbers in our reports and our financial reports. No, we are really with them and for them. That's our slogan. Maybe you would know that also, Dr.
Thank
Ibi.
you.
So,
Yes,
yeah.
yes. That took a lot of our time back then. Anyway, we still have roughly 10 minutes. I'd like to spend the remaining time to discuss a very important issue, which is inclusion. You know, when this last escalation happened and we had the massive displacement of Lebanese essentially from the south, but later on from the southern suburb, I've seen some articles, social media posts about making sure that Syrians are not forgotten. But these same posts or articles or opinions forgot that we also have Palestinian refugees in camps. And we also have a huge community of migrant workers, who some of them were left on the streets, I heard, right? And we have other vulnerable groups as well. So my question to you is based on your observations from the field. Where do we stand on this issue of inclusion? Are there groups that are still forgotten, like entirely forgotten, or are we doing a little bit better on this issue of inclusion? Thank you.
If I might start, and I encourage others to pitch in. So the displacement is quite big, and there's not enough shelters, right? Even rented places for people to stay in. And so because of this, yes, we've seen that we have issues with inclusion, with preference to first, the preference is Lebanese, but also we see discrimination based on sect, or there's some areas that are not welcoming to even Lebanese displaced, right? So we've seen trends that Palestinians, for example, Palestinian displaced people are mostly being hosted in other refugee camps rather than in the community. But Syrians are having problems of being hosted in other areas. So it all depends. Yani, we have issues. There are, explanations that it's because of lack of enough places, but I think the root causes run deeper than this.
Thank you, Samar. Any other input on the issue of inclusion?
Sorry, I'm not raising my hands really because because no one is.
No problem. Go ahead.
I'm pitching in with, directly. It's embedded within the CCCL mission and vision. It has never been the case that we've said no to patients that based on gender, on nationality, or not even one report that had accused us of doing so. Now, this is subject to fund availability and, of course, subject to reports from medical. This is the only two reasons why we, as a CCCL, can say no to anyone. It's the last report I read about the equality of access to treatment by the center. it's 20% of our population is of non-Lebanese. That's nothing to do with us choosing, but this is how it's split. I can even remember a case where an African man had traveled from Africa because he was told that the center has a good treatment facilities, and that he was looking for the center and he couldn't find it. And then I don't know how my friend saw him crying in the parking, and he guided him to the center, and we treated them. We treated him and then the kid, and then he's back into Africa living survivor. We have all type of nationalities in our champion circle club, survivors club. That demonstrate that we've throughout the years have had many nationalities and many we have no discrimination whatsoever. So I don't know if I made my case or I answered the question, but this is
Thank you very much. That's very useful. Any other input on this issue of inclusion?
I would like
Yes,
to
Sausan.
I think inclusion is is an issue that is not really well tackled, despite all the efforts that have been exerted on this. We work with people with disability, we work with vulnerable groups, we work with elderly, and still we don't see inclusion, even in schools and KGs and whatever, in anything, you don't see inclusion. Still, we're far from inclusion. And now with the crisis and with the emergency situation, I think we're far from inclusion. There is effort, definitely. Many are having this as a priority whenever we're intervening. Many organizations are giving this issue a priority, but I think we're still lacking on that. And I think definitely we have to take it into consideration whenever we're planning for emergency.
Thank you very much. Thank you, Sausan. Well, I think in the last few minutes left, yes.
We have a question in the question tab.
It doesn't show on my, can you just say the question because I can't see it?
Sure. The question is from Fadi Jelwan, and he's saying, based on what Dr. Ali mentioned in the beginning about the long-term effects, don't you think there is a need for a long-term plan based on the coordination between NGOs to be proactive and not reactive once the war is over? We have witnessed some imbalance in aid and support due to poor coordination in the past 2 months.
I think I don't think anyone would answer no to this question. Yes, we definitely need a long-term plan and proactivity, but I leave it up to the panelists. Anyone would like to weigh in on this question? I guess it's obvious that
definitely
we need a long-term plan and we need to be proactive. That's a very good point. I don't know if Fadi is just making a statement here or asking a question. I think he's making a statement. But anyway, I think we all agree with the statement. So if there are no further comments, I'd like to return the floor to Nihal. But before that, I'd like to thank every one of you. Thank you for your insightful presentations and for your readiness to answer the tricky questions. I'd like to thank the audience as well. And finally, to thank again the Arab Foundations Forum for this great initiative. Thank you. Nihal, over to you.
Thank you, Dr. Ali, and thank you to all our esteemed panelists. Thank you so much for sharing your work and all that you do. We do have a last question. I don't know if we have time to answer it, but I'm going to go ahead and try. Rudaina is asking, what are the aspects of collaboration between NGOs here that are serving the Lebanese communities? If anyone wants to take that, I'd be happy to give the floor. And if not,
of course, Nihan, this question and the previous question is very important, but these are the collaboration between different NGOs is very essential. Not only NGOs and private sector. We've seen programs at the center that are sponsored by private sectors, and that's why it's continued throughout the years, such as the wellness program. The wellness program is a set of activities from yoga to music therapy to art and craft and drama therapy, and this is the collaboration between different sectors and different stakeholders is very essential for the continuity of the NGOs and the supports that NGOs does. Now, in this panel, I see different missions that may be a complementary to each other's, but not replacing each other's, and that's why probably you've chosen the NGOs that you have chosen. With regard to the proactive, I mean, you do have a proactive strategy and plans, but so far, the NGOs still learning, because in every crisis it's a different kind of a crisis. And we never expected COVID to happen. We've never expected the war to escalate as much, because we're always under the impression that we're avoiding this escalation. We've never expected the banking sector to collapse, and knowing that the banking sector is one of the strongest Lebanese economic factors in the GDPs and whatever.
Thank you, Ahmed. I have to cut you off. I'm so sorry because we're at 9:30. Sausan, I think you had your hand up. Is there something that you want to add before we go? Real quick? No, you're good?
I don't want to say further. Thank you.
Thank you so much. Thank you, Dr. Ali, for moderating our session. And thank you to all our attendees. I'll be sending out an email with all the relevant links and donation links. And if you have any questions, please feel free to email me. And thank you, everyone. Thank you for being here.